My name is Michelle Nicole Johnson, and my presentation is titled Health Misinformation, Disinformation, and Malinformation, a Guide to Government Publications and Resources for Community Engagement. The purpose of this presentation is to share government resources aimed at promoting health literacy and preventing the spread of false information, known as misinformation, disinformation, and malinformation. The primary audience includes public and academic librarians, teachers, faith leaders, truck drivers, journalists, postal workers, engineers, doctors, nurses, lawyers, custodians, beekeepers. Okay, hopefully you get the point. While the majority of the people in the audience are librarians, future librarians, and library staff, anyone and everyone can use these resources to start conversations and potentially stop the spread of misinformation, disinformation, and malinformation, whether you encounter it at work or at school, your place of worship, on social media platforms, or at home across the dinner table at a gathering of family and friends. Anyone and everyone can use these resources. Before we get started, please note that all of the examples mentioned here can be found in a LibGuide that's been created for this presentation. You can use the guide to view additional examples of government publications or search for more using the links we've provided to government databases and search engines. I will share the link to the LibGuide at the end of the presentation. So before we get started, let's go over some definitions. According to the Cybersecurity and Infrastructure Security Agency, misinformation is defined as misleading, false information that is communicated and spread regardless of intent to deceive. Disinformation is false information intentionally and strategically crafted to be deceptive. Malinformation is factual information that is intentionally taken out of context or manipulated and presented to cause harm. Disinformation and malinformation are maliciously created by people seeking financial gain or political advantage, or just to be chaotic and cause sabotage, according to the U.S. Surgeon General. Some government publications and resources use the term misinformation regardless of the intention of the creators. Others distinguish between the different types of information or refer to them collectively as MDM for misinformation, disinformation, and malinformation. In this presentation, we will often use the acronym MDM. Health literacy is defined as the degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions for themselves and others, according to Coughlin and the Centers for Disease Control and Prevention. MDM has been around forever. It is as old as human communication. False information originally was transmitted by word of mouth, and as technology has advanced, it has gone from verbal communication to written communication, from pen and paper to mass production by printing press, the telegraph, the telephone, radio, television, computers, and the internet. And with each advancement and with new technology, the speed at which false information can be produced and shared and go viral has increased dramatically, according to the Center for Information Technology and Society. Throughout history, whenever and wherever there has been human suffering, there have been those willing to spread lies and mislead and exploit vulnerable people, according to Posetti and Matthews, as well as the U.S. Public Health Service. During the H1N1 influenza pandemic of 1918, which killed 50 to 100 million people worldwide, Unproven miracle cures were abundant, conspiracy theories ran rampant, and there was resistance to vaccines and social distancing and masking protocols, which were created to prevent the spread of the virus, according to Hobday and Kaysen. And nothing has changed. The current COVID-19 pandemic, which began in late 2019 or early 2020, has seen a repeat of that history. Despite advances in medicine and technology, rumors, conspiracy theories, hoaxes, and other MDM have become so pervasive that the World Health Organization has declared an infodemic in the midst of the pandemic. Health MDM wastes time and money, but the threat is more than financial. Health MDM costs lives as people who are confused by false information prolong or avoid medical treatment, avoid vaccines, and ignore social distancing and masking protocols, which could save their lives or the lives of their loved ones. Health misinformation negatively affects individual decisions, leading to poor outcomes in physical health, mental health, and continued viral spread, according to Caceres. In response to the prevalence of health MDM, several government agencies have published books and created toolkits and other resources to encourage individuals and community organizations to begin pushing back against false medical and health information whenever it's encountered. So in this presentation, I'm going to share a few examples of some of those resources that have been created in response to the prevalence of MDM. The National Library of Medicine bookshelf is a great resource for books on health literacy and MDM. Many of the publications that you'll find there are workshop summaries, and some are published proceedings, while others are published research. And these are 3 examples of books that are available through the National Library of Medicine bookshelf. The Cybersecurity and Infrastructure Security Agency has published a graphic novel series called Resilience, and one of the books, Bug Bites, is about health MDM. So this is another resource that you can use to reach people in your community, especially younger people who may be interested in a graphic novel. If you are interested in journal articles on MDM and health literacy, your public or academic library most likely provides access to health-related databases. However, articles are available online for free from a variety of government sources. Articles can be found online at the National Library of Medicine, which includes PubMed, Medline Plus, and the National Library of Medicine bookshelf, which we've already talked about. In the presentation LibGuide, we've provided links to several articles that we've pulled for you about health literacy and MDM. Infographics designed by government agencies can be emailed, embedded on websites, printed and displayed, or given as handouts. The one on the left is actually much larger and longer, and it explains the scientific process, using colorful graphics and layman's terms. And the one on the right is from the Surgeon General, and it includes tips for talking with family and friends about misinformation. Government reports provide data and testimonies from hearings as well as research on the impacts of MDM. Sites such as the Congressional Research Service, the Law Library of the Library of Congress, as well as the National Library of Medicine provide access to government reports. You can find multiple health literacy videos on government YouTube channels and on their websites. And this is an example of one from the U.S. Surgeon General. This is announcing his initiative or his office's initiative to combat health MDM. Health and Human Services, the Food and Drug Administration, the National Library of Medicine, and Medline Plus are examples of agencies that offer videos and tutorials on health MDM. The National Network of the Network of the National Library of Medicine, or NNLM, has a health misinformation webinar series, and in the spring of 2023, the network did a virtual symposium on health misinformation. So be sure to check out the network's channel on YouTube to access those videos. Speaking of the National Library of Medicine's network, membership in the network is open to community organizations that provide health information resources to the public, and that includes academic and public libraries. Membership benefits include access to free informational materials, training, and grant funding. Toolkits and field guides bring together multiple resources, including videos, infographics, lesson plans, slideshow templates, talking points, and more, and are provided free of charge to individuals and community organizations that want to do their part to stop the spread of MDM. These are examples of two online toolkits. The one on the left is from the Surgeon General, and the other one is from the Centers for Disease Control and Prevention. It's important to keep in mind that while the creators of Health MDM may have malicious intent, the people who share it often do not mean any harm. These toolkits and other resources are useful because many of them encourage dialogue and empathy and promote listening to understand people's fears and beliefs and why they're sharing this information. Health science can be complex and nuanced, and misconceptions and misunderstandings can easily arise when people are afraid and try to make sense of information they do not understand. So these resources encourage people to be skeptical, to take the time to ask questions, evaluate resources, and dig deeper for evidence-based facts before sharing information. They encourage critical thinking. Thank you for viewing this presentation, and please don't forget to visit the LibGuide. It includes these resources that we've talked about in the presentation, as well as others. Plus, there are links to search engines and databases to help you find more government publications and resources. Access the guide by scanning the QR code or go to libguides.ccga.edu/misinformation. And these are the references for this presentation.